June is Cancer Survivors Month, and thanks to advances in detection and in treatment, more people are living longer after a cancer diagnosis than ever before. But for many survivors, the end of treatment, it does not always mean the end of the emotional and the physical challenges that come with a cancer diagnosis. So joining us right now to talk about the sometimes hidden side of cancer survivorship and what can help patients continue to move forward is Dr. Jane Mizell with the Winship Cancer Institute of Emory University. Doctor, thanks for being with us.
Yes, thank you so much for having me.
So when we talk about a cancer diagnosis with somebody going through treatment, remission is a point of real celebration. And I think in the minds of a lot of folks, particularly folks who haven't gone through that, it marks the end of the journey. But from what you've seen in your clinical experience and working with patients, in some ways it's kind of the beginning of another journey, right?
I think that's absolutely right. I think that there are a number of different reasons for that. The end of treatment, I think for many people, you feel like it's supposed to be, like you said, this time of celebration, this time of return to your old life, leaving cancer behind you, which it is in many ways. But I think there's also this anxiety that can come along with finishing treatment and being at that end where all of a sudden you might not be seeing your doctors as much. You might not be quite sure what your plan is or what your risk of recurrence might be. And there can be some uncertainty and insecurity that go along with that. And I think also sort of that unspoken pressure of now you get to get back to your own life. Now you can celebrate. Now you're supposed to feel just like you felt before. You can sort of feel like you're not living up to that because truly, after a cancer diagnosis and treatment, your life is forever changed. And rather than going back to your old normal, you're sort of finding what that new normal means for you. And that in and of itself is a journey.
What do patients tell you when they are in that moment of transition?
I think I always try to acknowledge, and I think as a cancer community, we're doing a better job of trying to acknowledge that that uncertainty is normal. I think often it will come out in questions such as, now that I'm done with treatment, how often do I see you? What are the ways in which we monitor for recurrence? What are the kinds of things I need to look out for? And I think, almost like when someone is newly diagnosed with cancer and comes to clinic with that fear, there's that fear that sort of can also come up when you enter the survivorship period. And just like when you develop a treatment plan for your cancer, you need essentially a survivorship plan. You need to know what to look out for. You need to know what your follow up looks like. And once someone can kind of give you those guidelines and that plan, it can feel, I think, a whole lot easier.
Anytime we talk about somebody who faces a tough medical diagnosis, that cancer certainly is, always a component of that conversation is that it's a team effort. Your family, your loved ones, your friends. It makes such a difference
Absolutely.
when you can have that big community rally around you. So I'd be really curious for your thoughts and for your message to the folks around somebody who gets to that point of getting to remission. What advice, what words of advice would you have for the friends, the family, the caregivers? What can they do to help somebody into that next chapter, that survivorship chapter?
I think it is important to celebrate on the one hand because patients who are entering that survivorship chapter have been through a lot. They've gotten through a lot and they've, achieved something that most people never have to go through. So I think it's important to celebrate with people, but also to sort of understand from the patient, kind of how they want to celebrate, and making sure that you're not, as a loved one, making it something more than what they want it to be. But I think also acknowledging, as someone, if you're someone who has not gone through it, that people are kind of entering that new normal and they're figuring out what that survivorship phase looks like for them. And whether it's, side effects from chemotherapy that could be lingering or, challenges with body image that may have changed after a mastectomy, say for breast cancer. People may be still dealing with things that they don't always want to talk about or that aren't always readily apparent. So just making sure that you're there for people in ways, not just to celebrate, but also to talk, to distract, to be understanding if people are, entering that survivorship mode and aren't totally ready to get back to their normal life.
I mean, and you know it from your work, working with patients firsthand. It
Mhm.
is a monumental life moment and really a life experience. It's not like it happens in one moment. Treatment can take many months. There are all the steps that are taken after remission, the scans, the follow-ups. It's a huge pivot point in many folks' lives. Yeah, I'd be curious, and I'm sure many people watching would be curious too, what kind of resources are out there for somebody who reaches that undeniably excellent moment where you get to remission, you close that door, and now you're entering this new chapter. you want to move on, but you still have to keep a little bit of an eye on making sure you're following up and checking in. What resources are out there for somebody who wants to navigate that, not just from the medical side, but also from the personal side, the perhaps some anxiety goes along with it? What resources are out there?
Absolutely. So I think that's so important. And it does, it takes a village in terms of family, friends, and loved ones, but it also takes a village in terms of care providers. As an oncologist, I often consider, ourselves sort of like the quarterbacks of the team for a long period of time. But then at the time where patients are finished with treatment, having a really strong survivorship team also becomes such a critical piece of the plan. And so, we often talk with patients about the different resources that are available. And, you touched on something important with anxiety, which I think is so prevalent in our society to begin with, but also after cancer can be quite prevalent. And so, having a therapist to talk to, and, we often will give names of people we've worked with or that our patients have worked with, strong networks, but also things like nutritionists to help with optimizing diet. Exercise therapists to help with patients wanting to get back in shape after cancer, and other things like that. And Emory Winship actually has a survivorship program that is opening in this coming October. We already have a survivorship clinic, but a more dedicated full survivorship program that's going to incorporate a lot of different things, not just exercise, diet, nutrition, mental health, but also even research about survivorship efforts and how we really can best be optimizing care going forward for patients. And I
How?
think, you've
Go
heard,
ahead.
you've heard in the news, and many of your viewers have probably heard also about early onset cancers being so common that we're seeing more young patients diagnosed with breast cancer and colon cancer and a lot of these things. There's research going on looking at that as well and what some of the ongoing risks might be for our young cancer survivors. And thinking about things like fertility and things like that after cancer also. But my point about that was going to be just that it's important to make sure we're considering all of these aspects for our youngest patients who may be really entering into new normals that patients decades ago never really had to experience.
Just a couple last questions for you here, Doctor, on a certainly really important topic. From your vantage point,
Mhm.
how important is that survivorship stage of caring for yourself and getting the care that you need in terms of the long-term outcomes for folks who have gotten a cancer diagnosis, they've gotten to a point where it's in remission? How important is that next stage in remaining in remission and getting back to a full and fulfilling life?
Oh, I think it's absolutely critical. One thing that I have noticed, and I've been at Emory now for 11 years, so I've had the opportunity to see a lot of patients, from diagnosis through treatment and out the other side to survivorship, is that a cancer diagnosis can sometimes be actually an opening into taking better care of yourself overall. A patient might get a cancer diagnosis, and prior to that, not have had a whole lot of interaction with the healthcare system. But through getting treated for cancer, they get introduced to things like weight management, might find a high blood pressure or high cholesterol diagnosis that they didn't know they had and then need to manage, other things like that, so that patients remain tied in. And survivorship programs that, again, help with optimizing things like diet, exercise, weight, mental health, can really go a long way towards not only reducing the risk of recurrence of the cancer that they had, but reducing the incidence of future cancers, and also leading to healthier lifestyles overall. So I think there really can be a lot of benefits to kind of capitalizing on that survivorship moment, and empowering people to really take control of their health over the long term.
All right, Doctor, we're short on time. One last question for you here, kind of summing everything up to somebody who is watching this, to somebody who has reached remission, or maybe they're just starting their journey down this path. They've just got a really tough diagnosis, or they're on the other end of the spectrum where they reached remission years ago and they're still kind of finding their way through this process. For anybody on that journey, what advice would you give them?
I think first I would tell you, to acknowledge that you are walking a really hard road wherever you are in a cancer journey. It's such a challenging time, and to give yourself a lot of grace. I think the other things I would say are make sure you ask questions that come up for you, because the more answers that you get, the more empowered that you'll feel. And like I said, kind of at the beginning of this interview, at almost any stage, if you have a plan, you'll be able to follow that plan and get through it. So making sure that when you leave your doctor's appointments or your survivorship appointments, kind of what your plan is going forward, for the next week or two, certainly if you're in the middle of active treatment, but over the coming months, if that's, kind of where you are. And, making sure that you feel empowered to ask the questions that you want to ask so that you get the answers you need to move forward.
All right, Dr. Jane Mizell at the Winship Cancer Institute at Emory University. Thank you for your time, and thank you for your perspective on this very important topic.
Yes, thank you for having me.